So I am a professor in pediatric infectious diseases at the medical center. And my path is, so I grew up in Long Island, in that little area that's circled there. It's in Nassau County, pretty close to New York City, but a suburb of New York City. My parents were research scientists, so they were not in medicine at all, but they were always very interested in discovery and scientific mechanisms of things. So we talked a lot about that kind of stuff in my house when I was growing up. And I didn't quite know what I wanted to do when I was heading to college. I knew I was more focused on science and STEM fields rather than humanities. So I ended up going to college. This is my path here. I went to college at Swarthmore, which is this little college right outside of Philadelphia, and I got a bachelor's in biology. How boring, right? I wish I could have done medicine, health, and society, but we didn't have such cool majors like that when I was in college. And then I did some research in the summers in between, academic years, and I worked in different labs, different summers, but it was all kind of biomedical-based, laboratory-based research. And I kind of liked it. But I wasn't quite sure. I couldn't imagine myself like loving it so much that I wanted to do that for the rest of my career. Okay. So then I thought, well, maybe I need to think about, kind of like many of you are, I'm interested in medicine. I'm interested in public health. So there's these things called, I didn't know how I was going to pay for medical school. That was a big concern of mine. And so at that time, not knowing any better, I applied to a couple of MD PhD programs, and I interviewed at several, and I ended up going to WashU in St. Louis, which was among one of the larger MD PhD programs at that time. And I ended up staying there 9 years. So that's a really long time. So for those of you who are considering MD PhD, it's an amazing path. I can talk to you about what I think the benefit of that path was for me, but it was a really long haul, right? So when I was in grad school, the project didn't work as quickly as I hoped it would. It took a while to get my papers and primary author manuscripts out there. So I was in the lab for 6 years, and then I did my medical training in 3 years, medical school in 3 years, so a total of 9 years. And I worked in a basic science lab. I worked on the malaria parasite because I was always kind of interested in global health, infectious diseases, and there was this amazing lab with this great mentor, and it was a malaria lab. So that was interesting. But then I went and I really, my MD PhD program was structured as 2 years of didactic training for med school, followed by all these years in the lab doing research, followed by clinical rotations. And it really wasn't until I did my clinical rotations that I really understood what medicine was like. And I said, I really like clinical medicine. So I ended up moving further west. I went to San Francisco, UCSF, for Pediatrics residency and Pediatric Infectious Disease Fellowship after that. And for me, we can talk a little bit more about this later, but the decision to do pediatrics wasn't that difficult for me. It was really clear after I'd done all my clinical rotations that was where I was gravitating towards. And then I took number 5 on this slide is I took my first faculty job at Mayo Clinic, because by then I had 2 kids. I was married. I had 2 kids. San Francisco, for the amazing place that it is, was incredibly expensive to live in. And so we moved back, to the Midwest, where it was the cost of living was much better. And I had a really fabulous job there. And then after 7 years there, my husband said, "It's really cold here. Can we go someplace a little warmer?" So that's partly why we moved to Vanderbilt in 2016. The other main reason was that it was an amazing job opportunity for me. So I've moved around quite a bit. I've diversified my training, and I think that, there are many reasons to do that, and we can talk more about that too. Let's see if I can advance. So, but, I think it was not clear to me when I was at your stage where I would end up and what I wanted to do. I knew at that time that I liked science, discovery, and investigation. I knew I wanted to do lab research and discover things that were really relevant to human health. That's what I wanted to work on. And then when I did my clinical rotations is when I realized I really like talking with patients. I really like interacting with families. And that really solidified this idea that I wanted to do not just basic science, laboratory bench research, but what's called translational research, or research that really impacts clinical care. And then I had always known I liked infectious diseases. I had traveled to India to see extended family. I had seen so many infectious diseases there. So I had done my PhD in malaria. I did my postdoctoral work in staph and other bacteria that causes all sorts of infections. And now I do clinical research in infectious diseases. I actually have conducted several clinical trials looking at the use of rapid diagnostics to detect bacteria in patients' blood and how to implement them and how to actually operationalize them in the clinical environment so that clinicians can act on those results quickly and can get patients on appropriate care quickly. So it's outcomes research, but it really utilizes the tools that I've learned all along my road. I was doing basic science research early on in my career, and I learned all sorts of tools about how to design experiments, how to ask questions, how to present data, how to graph data, how to kind of disseminate data in presentations to your lab, for example. I'm still using all of those skills today. I'm just doing very different kind of research. Okay. And then I think I wanted to just emphasize that, I do have a family. I have a husband, 2 daughters who are in high school, and 2 dogs who are important parts of the family. So just when I was in your shoes, I wasn't quite sure that it was possible to do everything I wanted to do professionally and still have a personal life, but it is possible, and we can talk about that as well. I have seen a lot of women, especially as they get on in their medical training, make choices and decisions about the path and further training, that they might do or might not do because of limitations they think that they can't do what they want to do personally because of the time and the commitment that more training would require. I'm happy to talk with you about that. But my typical day is, no day is the same, okay? And so that's what I love about my job. It changes day to day and week to week. So about 25% of my entire year is spent with patient care, inpatient infectious disease consultations on patients who are hospitalized with, infections or infectious problems. I spend about 30-ish, 35% of my year doing research, writing grants, writing papers, going to meetings, doing presentations, and working with research trainees and members of my research team doing clinical trials. And many of these clinical trials are actually in international sites, so that allows me to travel, which is a very exciting part of my job. I spend about a quarter of my time doing education and mentoring, primarily of fellows, infectious disease fellows. So these are people who graduated from pediatric residency and have decided to subspecialize in pediatric infectious diseases. And I mentor them both in research projects and also in, when we're on the wards together in the clinic. And that occasionally I do see residents and med students if they're interested in working with me. I can do that as well. And then I spend a lot of time, this became a big part of my job during COVID. I spent a lot of time in administration and hospital operations trying to sort out how can you run the hospital when you have to isolate all these patients with COVID. You have to test every patient who's coming in. You need to do surgeries, but you need to test these patients. They have to get their COVID test before they can have their procedures. Nobody knows how to treat COVID. How do you create the guidelines that are needed to manage these patients? That kind of thing. So it varies quite a bit day to day and week to week, but that's also, I think, one of the amazing things about a job like this. It's never boring. And so along the way, I think what has helped me get to where I am is tremendous mentorship. So I have been very proactive about seeking out mentors. These are mentors who are not just pediatric infectious disease doctors, but mentors who are doing interesting research, mentors who might have been in adult medicine, mentors who are working in a particular organism that I was studying at the time, right? And I was not shy about reaching out to people by email, and people are very happy to help. It's been challenging, of course. Many things took a lot of time. A lot of experiments failed, right? But you have to have trust in yourself and be persistent and work hard. And all of you, based on where you are right now, are really smart and really hard workers, right? And I surrounded myself with supportive friends and partners. And I think that's so critical, especially as a woman going into medicine. And now, in a role where, you see how important mentorship is. I am a mentor for mentees, people who are in your shoes, and I want to be a role model for folks like you, right? So it's just really important to surround yourself with positive people. And I have had a very supportive staff throughout all this because it's a really, really long journey, right? So I think I will end there, and hopefully I will stop sharing. And I would love to take your questions and, see if I can impart any wisdom.
Yeah, so we have a couple of questions. So going off of what you were talking about with mentors, how do you recommend students build bonds with their mentors?
Yeah, so there's no formula for this, right? I think the first thing is people like me, we love it when people like you reach out to us and say, you're really interested. Can you shadow us in the clinic? Do you have any research projects? Well, that kind of stuff. So reach out. That's the very first thing. Identify people who are working in an area that you might be interested in. Some of you have mentioned, you might be interested in oncology or neuroscience. Get on the websites and look at the faculty who are listed on those, in those departments or divisions, and see if there's anybody working on something of interest to you. Look up their papers, maybe, on Google Scholar or PubMed. See if they're working on an interesting research question. And if at the end of the day you can't tell based on that, just email them and see if you could meet with them. Okay, and then I think if you demonstrate that you're bright, you're curious, and you're eager to work, they'll identify if they have a project for you or not. And if they don't have a project for you because they don't have bandwidth maybe to mentor at that moment, they'll put you in touch with somebody who might be a good fit for you. I think the most important thing is to reach out. Be proactive. Don't be shy.
Okay. So the next question is, could you speak about managing personal life and training? It seems like so many of the things this person says that they won't have any time for family during medical school or residency.
Yeah, I mean it's busy, but you make time for the things that are important for you, right? And self-care is so important. You guys are very good at time management already with all of the different things that you have to manage in college, right? Med school, it's very structured, right? You have your classes, you have your rotations. Residency, in a way, is even more structured because you have your call schedule, etc. But then you're not working 100-hour weeks anymore. There are duty hours and work hours. So during your off hours is when you really focus on being with your family and the people that you want to spend time with, right? I think you make time for those. There is time to nurture relationships and all of that stuff. during med school, during residency, during fellowship, and even at my stage. It might feel like, oh my God, there's more and more and more just added to your plate, but you will figure out how to do it. For me, one of my biggest mottos is done is better than perfect. At your stage, I was such a perfectionist. The things I turned in were like, I agonized over them and they were, really well done. At my stage, I get things done. I still try to do a good job, but they don't have to, maybe I'm not agonizing over them as much because I just don't have the time. You'll figure out time management. You have to figure out, you don't try to waste, you have to figure out how not to waste time on email, text, social media, etc., and do the things that you have to get done, right?
Thank you. That was very informative. So our next question is, what is some advice you would give to prospective students when looking for MD, PhD programs, and just also some advice you would give to people interested in pursuing an MD, PhD?
Yeah, I think you have to really think carefully about your motivation for doing it, okay? Because it is a really long haul. I'm very glad at the end of the day that I did it, but I'm not doing the type of research that I thought I would be doing when I entered an MD PhD program. And many of the folks, many of my classmates who entered the MD PhD program with me completed it and got both degrees, but they're not doing research anymore. Many of them are just doing clinical medicine, or went into industry, or didn't stay. The initial impetus for starting MD PhD programs by the government was to create physician scientists who would be academic in nature, right, and be people who are doing research and doing some clinical work as well in medical centers. So I think the majority of people who go through MD PhD programs might not fit that mold anymore, and that's okay. But not everybody can tolerate going through a training program that takes so long, right? So I would say the first thing is to just really dig down deep and make sure your motivations for doing the MD PhD program are important. Like, are you really interested in discovery and that really excites you? Then you should really strongly, and do you want to do research that's really relevant to clinical care? The questions you ask in your research are informed by some of the clinical questions you have when you take care of patients, then you are absolutely the right type of person that MD PhD programs are looking for. And then I think the other thing to know, which nobody told me when I did an MD PhD program, is that there are many different kinds of research. So it doesn't all have to be basic science bench research. There are lots of programs that now are allowing people to do more clinical and translational research as part of their PhD, or even PhDs in epidemiology. So if that is interesting to you, really reach out to the schools that have those options as part of MD PhD programs. And then I would look broadly. Many different kinds of schools all over the country offer MD PhD programs. And I would just look broadly. Don't restrict yourself just to a certain geographic area or et cetera. And then if you, of course, identify a researcher who's doing work in exactly what you want to work on, then that is a reason to prioritize, going to that particular place. I think that's the exception rather than the rule that people have identified that lab where they want to work at your stages.
Can you speak more about how you chose your specialty, specifically like pediatrics and infectious disease?
Yeah. So it was very obvious to me early on after, when you are in medical school and also when you're in residency, actually medical school, you go through all these different rotations and met the Department of Medicine, pediatrics, surgery, etc. It was really obvious to me early on that surgery was not for me. I just did not feel comfortable in the OR. It was amazing to watch, right? But I did not want to be the one who was actually doing those high-risk procedures. So then for me, then it was not surgery, but medicine or pediatrics. And what I loved about medicine or pediatrics was the complexity of some of the pathophysiology that we could see when we were taking care of these patients. And I really liked intensive care. I really liked the ICU setting. But at the end of the day, what drew me to pediatrics over adult medicine was that the children were incredibly cute. And right? It was just such a pleasure to come to work every day and actually deal with, even if they weren't cute, even if they were grouchy teenagers, like my own kids are right now. They're still so interesting. And pediatrics was, such a wide range from birth through early 20s, right? And so you have to really adapt in your interactions with the patients to what is age appropriate for them. So that was challenging, but also so stimulating for me. And there were patients that were as medically complex in pediatrics as they were in adults. And I love that. And that most of the pathology that we were seeing in pediatrics was not their fault, as opposed to in adult medicine where some of the pathology was related to behaviors that adults had engaged in for years, right? I'm talking about smoking, alcoholism, etc. So those are kind of the things I thought about when I was choosing a subspecialty. And at the end of the day, it's your mentors. And I had the best doctors that I worked with were pediatricians in the places where I trained. So that also kind of made me gravitate towards peds. I haven't regretted it ever. It's a great specialty. And you can do any subspecialty you want in pediatrics. So oncology, there's lots of oncology in pediatrics. Neurosurgery, we have pediatric neurosurgeons, right? Infectious disease, pediatrics, right? As well as adults. So.
Somebody asked, is there anything you wish you could change about your journey in medicine?
Sophie, can you say that one more time? I think the beginning of what you said got cut off.
Oh, sorry. Is there anything you wish you could change about your journey in medicine?
I wish I could have taken more electives because as you go on in your journey, you get more and more specialized, right? And so when you are just starting medical school is when you can really, you're a sponge, you can absorb everything and you can see all the different areas, right? I no longer get to, see what it looks like in the OR. I work with, for example, the urologists who've done a nephrectomy and removed a kidney on a patient. I don't really know what that looks like anymore. As a med student, I was able to observe that procedure, right? So I wish there were so many electives I didn't get to take, right? Just because of limited time. I think I would, if I could go back, try to take more advantage of that.
So the next question is, what has been the biggest challenge you have experienced on your journey in medicine?
That's a good question. Other than COVID, that was a really rough few years for us in infectious diseases. The biggest challenge, it's a challenge, but I don't regret having made this choice. It's just trying to working full time while my kids were really young. That was a challenging time. I never went part time. I had my first daughter when I was a third year of my peds residency. And I had my second daughter when I was an infectious disease fellow. So both of those years I was really on call quite a bit. And that was challenging. I was nursing, not sleeping much because they were waking up at night. So I had never been as tired as those years. But I don't regret doing that. I'm glad those years are done. I'm happy not to go back and do that again. I think another challenge might be, and this kind of gets into this issue of being a minority in medicine as well. I'm not an underrepresented minority in medicine, but as you get up in academic ranks and leadership positions and academics in general, the number of women in leadership positions goes down, the number of minorities in leadership positions goes down. So you just don't have as many mentors who look like you in these positions, right? And so you kind of have to find these mentors in other institutions if they're not at your institution. So I would say that is a challenge and continues to be a challenge, although institutions are at least talking much more about diversity and equity nowadays. Yeah, that's a great question.
Someone else asked, what do you think medical students tend to struggle with the most?
Did you say what do medical students tend to struggle with the most?
Yes.
I've been incredibly impressed with the medical students I've worked with, and they're Vanderbilt medical students because that's who I work with here. They're incredibly curious and they work really hard. I think, what do they struggle with? Maybe, I would say, maybe they're a little bit, it's all brand new when they're doing their clinical rotations, right? And so, I should back up and say, I don't teach any of the medical students when they're in their didactic classes. So I'm really just dealing with the medical students when they're on their clinical rotations and they see me in clinic or they see me in the hospital setting. So oftentimes this is the first time they're ever in those settings. So it's brand new and they feel a little intimidated and overwhelmed. So they're shy, they're quiet. So I would just encourage medical students to say, no question is a stupid question, right? Just ask questions. And that says to me, you're curious, you want to learn. It doesn't mean, it doesn't say to me that you're stupid, right? And I think all people are happy to answer questions. So med students I think, at least in the clinic, they tend to be, reticent. So they don't have to be. I think everybody's really eager to show you what my subspecialty is like, right? Yeah.
So next question, what do you think is something that makes someone like a standout physician?
A standout physician? Is that the question? Oh, there are so many ways people can be standout physicians. There are obviously the people who are diagnostic experts. So there's something wrong with a patient. All these different people have visited and can't figure out what's wrong with this patient. And then this one doctor comes in and is like, I know what it is, right? And there are people like that who it's either from experience or being so widely read, right? They've seen it all. So there are amazing people like that. There are also incredible doctors who just have developed such tremendous rapport with families and patients. And they are masterful at being really thoughtful and sensitive to the needs of the family and how to, for example, break bad news to a family and say your child has this really devastating diagnosis, right? That's an incredibly intimidating thing to do, but some people just do it so compassionately and so well. And so I really, really respect the people with that kind of a skill. Let's see. There are other physicians who are just incredibly amazing teachers, right? And all the med students and all the residents want to rotate when that attending physician is on. So there are many, many ways to be great doctors. There are also, so medicine is a team sport. There's, especially on very complicated patients, you'll have multiple subspecialists visiting trying to figure out what's wrong with this patient. And but what I mean when it's a team sport is they're just incredibly good at, so, you can't have one team saying it's this and one team saying it's this and another, and everybody's disagreeing. So there are some people that are really good at building consensus and getting teams together. I did not know this about medicine when I was sitting in your shoes, but it's really become apparent over the last several years that I've been, practicing medicine, that people who are great team players do really well, are really, really valued in medicine. And patients love them too. Yeah. There are so many skills that that they don't really teach us at least when I was in medical school, they didn't teach it to us, but we learned by seeing our role models do that. And one of those things is having difficult conversations with patients. You can't really teach that in a classroom setting. I mean, you can talk about it, you can talk about how to frame the discussion, et cetera, but you actually have to see a master clinician actually do that. Yeah.
So next question, did you find your
Sorry,
MD?
Sophie, are other people having trouble hearing Sophie, or is it just me?
Sorry, I might be talking really softly. Did you find your MD or your PhD training more challenging?
They were both challenging in different ways. I don't think I can rank them. The PhD was challenging because I couldn't control the rate at which the experiments that needed to get done could get done. I worked hard, really, really, really hard, and some projects just don't work, and you have to divert, and you have to change, you have to be flexible. So that ended up happening to me. That's kind of why it took me so long. The medical school training was challenging in a different way. So what happened, the MD PhD, this is really interesting, right? Because at least the way it was structured when I took it, by the time I graduated, I finished my PhD, I was like the expert in the lab. I knew how to do all the experiments. I knew how to do, I knew where all the equipment was. And I was training postdocs who were new coming into the lab, right? So I was like at the top of my game. And then you graduate, I finished my PhD, and then suddenly I'm thrown into my third year medical school rotations with people who are much younger than me. And I've been out of med school. I didn't take I took the med school classes 6 years ago. So I felt constantly like I was catching up. So in that sense, going back to med school after finishing my PhD was a little challenging for me, but I think it was more in my head, right? Because I caught up no problem. And I think the same, any of you who end up doing that route, you might feel a little, like you have to catch up, you're behind everybody else, but that's really more an internal struggle. I think you will catch up and do just fine, which is, what happened to me. So they were both the PhD and the MD were both challenging in different ways.
Someone asked, given that the MD PhD track takes 7 years to complete with Vanderbilt, what would you tell prospective students who are worried about the time commitment?
Yeah, well, I think it's incredible training. And if you see that your future involves some kind of research, then it's worth it. The other reason that the MD PhD is great is because for me, I didn't have to take out loans to go to med school, right? Which meant that at the end of my training, I could really do whatever residency or fellowship I wanted because I was interested in it, not because I was worried that I needed to make enough money to pay back the loans in a certain amount of time. So it granted me more academic freedom at the end of my training. And I will say infectious diseases, especially pediatric infectious diseases, the lowest paid subspecialty. So I spent a lot of time in training to make less money than some of my peers who didn't do fellowship. But that's okay, because at the end of the day, I didn't choose this route to make money. I chose this route because I find it to be a very gratifying, rewarding career. And I think it's awesome. It's fun. I get to do all sorts of exciting things and meet interesting people and help kids get better.
I don't think we have any more questions. So I just want to thank everybody for coming tonight. And especially thank you, Dr. Banerjee, for coming and giving us all this great advice and talking to us tonight. So yeah, everybody have a great night. And we'll see you at our next event.
It's my pleasure. I also just want to say everybody at the medical center would be happy to hear from you if you haven't identified anybody as a potential research mentor or even just a career mentor. If you wanted to ask anybody questions like this as you're kind of trying to decide which path you want to take. I think medicine now more than ever is a really exciting career. And many different ways you can go with a medical degree. So I'm really glad that you spent your time with me, and reach out by email if there are any other questions we didn't get to address.
Yes, thank you so much, everybody. And yeah, we'll see you at our next event, hopefully.
Great. Thank you. Bye-bye.
Thank you.